Quviviq is used to treat a certain sleep problem, insomnia. It may help you fall asleep and stay asleep longer, so you can get a better night's rest. Active ingredient daridorexant. Daridorexant belongs to a class of drugs known as sedative hypnotics. If your insomnia continues for longer than 7 to 10 days after starting treatment, talk to a doctor to see if you need other treatment. How to use. Take Quviviq exactly as your healthcare provider tells you to take it. Don't change your dose without first talking to your healthcare provider. Take Quviviq one time each night within 30 minutes before going to bed. Only take Quviviq when you can stay in bed for a full night, at least 7 hours. Quviviq may take longer to work if you take it with or right after a meal. Call your healthcare provider if your insomnia sleep problem worsens or is not improved within 7 to 10 days. This may mean that there is another condition causing a sleep problem. If you take too much or overdose, call a healthcare provider or go to the nearest hospital emergency room right away. Usually the dose for insomnia 25 mg to 50 mg once per night. Contraindications. Before taking Quviviq, tell your healthcare provider about all of your medical conditions, including if you have a history of depression, mental illness, or suicidal thoughts or actions. Have a history of drug or alcohol abuse or addiction. Have a history of a sudden onset of muscle weakness, cataplexy. Have a history of daytime sleepiness. Have lung or brain problems, including sleep apnea. Have liver problems. Are pregnant or plan to become pregnant. It is not known if Quviviq can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Quviviq passes into your breast milk. Talk to a healthcare provider about the best way to feed your baby during treatment. Precautions. Do not drink alcohol while taking Quviviq. It can increase the effects of alcohol, which can be dangerous. You may still feel drowsy the next day after taking Quviviq. Quviviq side effects. Quviviq may cause serious side effects, including worsening depression and suicidal thoughts. Call your healthcare provider right away if you have any worsening depression or thoughts of suicide or dying. Temporary inability to move or talk, sleep paralysis for up to several minutes, or hallucinations while you are going to sleep or waking up. Complex sleep behaviors such as sleepwalking, sleep driving, preparing and eating food, making phone calls, having sex or doing other activities while not fully awake that you may not remember the next morning. Stop taking Quviviq and call your healthcare provider right away if you experienced a complex sleep behavior. The most common side effects include headache and sleepiness.